We understand that, especially for your non-COVID symptoms, you're afraid to go to a doctor's office or a emergency room or, an urgent care center, but this is not the time to ignore your symptoms. Most doctors are offering televisits or inpatient visits if you want to go and see the doctor, but if you don't, televisits or phone visits. So you could actually get on a call with a doctor, and actually they could even see you in a like a Zoom-like setting.
Just as before the COVID era, in the COVID area, we worry about the same symptoms. Chest pain that's new or worsening, especially when you exert yourself, could indicate a heart attack or near heart attack and shouldn't be ignored. If you feel like your health has seriously changed, it needs to be dealt with and shouldn't be ignored. You should expect to see everybody working at the office wearing a mask. Ideally gloves too when they touch you. They should probably offer you, the patient, a mask as well to keep the facilities clean for other patients and reduce any potential transmission of infected droplets from you if you're an asymptomatic carrier. You should expect, just as you would at any other store, glass or plexiglass barriers between yourself and other people that you don't have to have physical contact with. And you should also expect that the rooms are being cleaned between visits very thoroughly, and that patients with potential signs or symptoms of COVID, like a fever and cough, are being screened out effectively before they even come into the office. If you're at home and you have very mild symptoms that you think could be potentially a sign of COVID, but you're feeling fine, you're not unable to do your everyday activities without experiencing, for example, significant shortness of breath, and you don't feel like you need to be in a hospital, then there's not a ton of benefit to getting tested right now because, again, they're probably just going to tell you to go home and isolate yourself. As we get into the flu season, that calculus could change a little bit because there's a lot of overlap between COVID symptoms and flu symptoms, and there is a directed treatment available for flu, so you'd want to know if you have that. As for antibody testing, I don't really recommend it to anyone right now, if only because the accuracy of those tests is not yet well known, but probably not as high as most people think. And in addition, although we can presume that, like with most viruses, antibodies and prior exposure give you some level of immunity, that hasn't been proven definitively. And so I wouldn't confidently be able to tell anybody that because you have an antibody, you can be any less cautious than anyone else. Your doctors are there. We're eager to help you and make sure that your health doesn't fall through the cracks, even as we're encouraging everyone to stay at home as much as possible. And you should definitely not ignore symptoms and definitely not ignore your chronic medical problems because they're going to get worse if you don't pay attention to them.